Namaste all. Welcome to the Facebook Live. Now, today we are here with Dr. Thomas, a spine surgeon, and we are going to discuss about the cause of the lower back pain. Namaste, doctor.
Namaskar.
Today I'm going to ask you few questions where a common man has in his mind about the lower back pain and the neck pain. Can we go forward, doctor?
Please go ahead.
So, what are the most common causes of back pain between the young and the mid age, and when one should start worrying about it?
So, neck and back pains are the second most common reasons why people go to see a doctor after cough and cold. So, it is a very common condition which most people experience sometime during their lives. The more common causes of sudden onset neck and back pains, most common causes, are usually muscular strains and ligamentous strains. Chronic back pain, that is back pain that has lasted for considerable for weeks to months, the commoner causes could be wear and tear in the facet joints or wear and tear in the disc, what is called as disc degeneration. When do people need to go and see a doctor? Is when the back pain is not settling down with medications, when the back pain is radiating down into the legs or into the calf, what is referred to as sciatica, or if there is any numbness and weakness in the legs or difficulty in passing urine associated with low back pain.
Thank you, doctor. We'll go for the next question. How can a person differentiate a simple muscular lower back pain to a sciatica pain, which needs a medical attention?
So, back pain, which is a very common condition, is located or localized only in the lower end of the back. And the reasons for that I've mentioned earlier. Now, occasionally the discs can herniate out and press on the nerves and cause pain shooting down the leg. Now, that disc herniation causes predominantly leg pain and it goes all the way down the leg, called sciatica. So, back pain, muscular back pain is localized to the back, whereas pain due to sciatica could be in the back but associated with pain radiating down the leg, maybe up to the ankle also.
So the next question, what are the red flag symptoms which comes for the lower back pain where the patient should not hold on at home and have to rush immediately to the hospital?
Okay. So, like I said, most of the time back pains are harmless and self-limiting and they get better on their own. But occasionally there are conditions or symptoms that should prompt you to go and see a doctor immediately. Number one, if there is pain radiating or shooting down the leg associated with numbness and weakness in the leg, and your legs are not, your toes and ankles are not moving, number one. Number two, if the back pain and leg pain is associated with numbness around the buttocks. And number three, if the back pain and neck pain is associated with difficulty in passing urine. So you feel that your bladder is full, but you're not able to pass urine. So these are conditions that should prompt you to go and see a doctor straight away. In addition, if the back pain is a result of a significant fall or an injury, then also you need to see a doctor straight away.
Thank you, doctor. The next question, how does a sudden onset back pain to the youngster adult requires a scan, x-ray, or does it subside on its own?
So a majority of people who present with acute back pain or neck pain, that is back pain for a few hours or a few days, usually do not require any x-rays or scans. Most of the time these get better on their own, usually with a course of pain medications and physiotherapy. So x-rays and scans are rarely needed in patients with very short duration of neck and back pain. If the back pain and neck pain does not subside with common treatments, then scans and x-rays can be considered.
Thank you, doctor. I'll go for the next question. What are the roles of exercise and physiotherapy in treating the lower back pain? And is there any moment of gym activities that patients should not do it and strictly avoid?
So physiotherapy and exercises probably forms the cornerstone of treatment for neck and back pain. So a majority of our patients go and see the physiotherapists, and even the kind of physiotherapy matters. So things like traction, shortwave, electrotherapy, stents are not really known to work in neck and back pains and are better avoided. So manual therapies, dry needling, Myofascial releases and exercises have been found to have good effect for the relief of neck and back pains. Things to avoid in the gym: we see a lot of youngsters nowadays coming from the gym who have come after deadlifts. So deadlift seems to be a major predictor for back pain in our practice. So I would encourage people to be extremely careful if they're doing heavy lifting in the gym. But cardio exercises and upper body strengthening are all completely okay. But avoid heavy lifting like deadlifts.
Thank you, Doctor. That was a most important question for all the youngsters, because now we see a lot of people going into gym.
Gym
Just they wanted to keep develop their muscles and
muscles
all
and
that. That
look.
was a very
Yeah.
good explanation on that. So many people have an MRI report showing a disc bulge and minimal symptoms that is being projected in the MRI report. How serious they could take these findings, and what do we do with such reports, and what are the treatments that is needed?
Okay, so it is important to remember that disc bulges and disc degenerations are predominantly age related processes. And by the time you're in your 40s and 50s, most patients are going to have some wear and tear in the disc, which is referred to as disc degeneration. So, treatment for back pain is based only on symptoms. So, you don't treat back pains, you don't treat MRIs, you treat the pain. So, if the patient has got no pain, that the patient probably does not require any treatment at all, irrespective of what the MRI shows in regarding disc bulges and disc degeneration.
Yeah, doctor. Another very important question for all the ITs and long sitting people. How do prolonged sitting and long distance travel and a bad posture contribute to the disc problem? And what are the particular changes that can be the office makers or the drivers could do on to protect their spine?
So, prolonged sitting, especially sitting in a bad posture, like slouching forward, can put excessive strains on the back and result in back pain. So, what we advise people whose jobs involve prolonged sitting is to get out of their chair every 45 minutes or so, walk around a bit, probably go to the cooler, have some water to drink, do a few stretches, and then come back and sit. This is for people whose job involves sitting for long periods of time. As far as drivers are concerned, they, you less options for them. It's difficult for them to get out of their car every 45 minutes. But if you're driving on highways, that's something that you can definitely consider taking a break once in a way, stretching, and then continuing your drive. So sitting with good posture, sitting with your back against the uh, back of the chair, sitting with your legs, your thighs parallel to the ground and your feet firmly planted on the floor, are ways to reduce excessive strains on the lower back and thereby reduce the chances of back pain.
Thank you, doctor. When is actually a surgery required indicates on the lower disc, and what is the outcome of the patient in reality compared to the continuous conservative treatment?
So there are some patients with back pains who and probably leg pains who may require surgery. So if they are degenerative conditions or wear and tear conditions, then initial treatment is always non-surgical. So we start off with medications and physio. But if that does not settle down the pain and the patient still continues to have pain that is bothersome and affecting their day-to-day activities, then surgery is a indication. So spine surgeries are much safer than they were a couple of decades ago. So most of our patients are out of bed and walking the next day and home the day after that. So the traditional worries or fears regarding spine surgeries are probably a thing of the past now, with uh, better training, better equipments, better knowledge of the spine. The outcomes following spine surgery are reasonably good.
What is the biggest myth about the lower back pain and sciatica when you see in your clinic or in a social media? What are the actual facts that the patient should know about it?
So there are hundreds of myths regarding neck and back pain. One of the common ones is that bed rest is the treatment for back pain, and people lie in bed for many days at a stretch, that has not been really shown to be effective. So, what we tell patients is continue with whatever activity is possible for you to do within the limits of your pain. Enforced bed rest is not necessary. Number two in India is that if you have back pain, you need to sleep on a hard surface or sleep on the floor. That's an old grandmother's story. There is no scientific evidence for it. So I tell patients sleeping in a comfortable bed that gives you good sleep is probably the best. Number three, avoid using pillows if you have neck pain. Another myth. There is, if you're, especially if you're sleeping on your side and there is this gap between your shoulder and the head, that pillow should fill that gap. Otherwise, your head is going to tilt to one side like this. Avoid using a pillow that is too big also, because then your head is going to be tilted to the other side. So keeping your head aligned to your spine, or keeping your head and neck aligned to your spine, is probably the best way to sleep, especially if you're sleeping on the sides. There are patients who say that patients who are told that they should avoid lifting or bending. And imagine a housewife who's told that she cannot bend and lift. There's hardly anything that you can do at home without bending and lifting. So those are all myths. So what we tell patients is, if you have a back problem and you have to bend, you bend your knees a bit so that the weight is taken on your thighs. And there is the other myth about traction. So traction used to be a popular treatment, many decades ago, and probably still being practiced in some places, not been shown to have any effect on neck and back pain. So probably best avoided. So those are some of the myths regarding back pain. Another one is that if you have back pain, never have surgery. That is another myth, probably dating from the 50s and 60s, when spinal surgery was not as evolved and was probably associated with more risks. But in today's day and age, I think we've crossed all those hurdles. Spine surgery is as safe as any other surgery.
Yeah. One last question, doctor. Can an herniated disc heal on its own, or does it have any progress or eventually need a surgery?
So herniated discs are not uncommon. So, and like I told you earlier, they present with pain that is shooting down the leg into the calf. Fortunately, a majority of them get better on their own. Around 70 to 80% of them get better on their own. And only around 15 to 20% of them eventually require surgery. So if somebody has a herniated disc with leg pain, the first line of treatment should be non-surgical, which would involve some medications. We typically give them something called a nerve root block, which is X-ray guided small steroid injection next to the nerve, and restricted activities, not bed rest, but restricted activities. A majority of patients will get better with this, but not instantly. It does take a bit of time, but a majority of people will get better with this. For those who don't get better within 4 to 6 weeks, we start talking to them about surgical interventions.
Doctor, lastly, can you just give us a much more overview on the treatment that is being given for this pain?
So, treatment for neck and back pains are probably can be divided into 4 different categories. I'm not talking about tumors and deformities. I'm talking about the regular neck and back pains that people suffer from. So there are 4 treatment options. Number 1 is medications. Number 2 is physiotherapy. Number 3 is some sort of spinal injections, especially if they have leg pain. And number 4 is surgery. So these are the 4 treatment options available. And we go in a stepwise manner from simple treatments to more invasive interventional treatments.
Yeah. Thank you, doctor. I think I have asked you so many questions which a common man had a doubt about it. Thanks for the valuable time that you have spent with us.
Thank
And
you. Thanks.
thank you.
Thanks, Pratibha.
Thank you.
Thank you.
Thank you, sir.